In this episode, we welcome back Alexandra from Just the Inserts to discuss the crucial role of parental decision-making in pediatric medicine. We'll explore medications to avoid and help you feel more confident in your research, even when faced with the standard of care pressure. Plus, we'll dive into the safety concerns surrounding GMOs and discover the remarkable power of the placebo effect. Join us for this enlightening episode and empower yourself to make informed decisions for your family's well-being.
The Discovery Doc Podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. Cece, a doctor of nursing practice, self-proclaimed toxin tamer, and mama of four, alongside
me, Anna Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives.
Welcome to the Discovery Doc Podcast. We are back with Alexandra with Just the Inserts, and we are going to dive into mommyhood. We've already had the baby. We had the baby last episode. We had a baby. Now
we're pregnant. We had a baby.
Now it's on to being mommy full time and all of the things that entails. And there are so many more inserts that you need to read because baby is here and mommy is doing all of the things. So I don't have my question.
Yes.
What's my question?
I'm reorganizing my questions because man, we've just had some really, really good conversations. So one, I would just say if someone is just starting, let's say we've had baby and we are just starting our journey and becoming more aware of wanting to look into these ingredients, wanting to look into the contraindications and the adverse reactions. Can you give us kind of two top tips for navigating medical inserts to someone who has never read them before?
That's a great question. So when I first started reading manufacturer inserts, I skipped through the first 2/3 of the insert because it was just really overwhelming. It's a lot of scientific talk, a lot of medical stuff that I just didn't have the background to understand yet. And so I went straight to the post-marketing adverse reaction section because I knew from my business background that whenever a product has gone to market, if there are any potential concerns, that those get reported to the government or to the manufacturer. And I knew that that was really important. If a product was listed on the post-marketing adverse reaction section, which is typically section 6.2, then that is something that I needed to pay attention to. And also that is a lot of times what is left out of the conversation for private membership organizations like the American Academy of Pediatrics. Most of the time they focus on preclinical or clinical data, which is before the product goes to market. So sometimes a product has only really been exposed to hundreds to thousands of people before it goes to market. And according to the CDC, sometimes rare or delayed adverse reactions are not known until millions of people accept that product. And I think it's also really important too, if you look in the glossary of the CDC website, the definition of an adverse reaction is an undesirable medical condition that is known to be caused by a vaccine or a medical product. So it's really important to understand that straight from the get-go. Some people might discredit the post-marketing adverse reaction section, but both the CDC, NIH, and FDA talk about the importance of that section. So yes, I would scroll straight down to that section, read it. Some of the times it's organized by types of systems, so cardiovascular system, general reactions as a whole, or maybe the specific things that happen to the liver, things like that, and you can read it. And most of the time when you read it, you're not going to understand it. So go onto your computer if you can, copy and paste straight from the insert into Google, your preferred search engine, and look up that adverse reaction. See what it is. So many times there are the scientific terms where it's actually something as common as hives or itchy skin or swelling, fainting. It's not going to be listed typically as that in the adverse reaction. So just copy and paste it and see what it is. Many things too, I didn't realize that it's important for you to look at the images of those things as well. Because if you look at the definition of it, it just sounds really kind of scientific and very in the weeds of things. But then when you look at the pictures of it, you're like, oh, okay, yeah, my daughter's had that rash before. Mm-hmm. Oh, okay, that makes sense. I was actually treated for antibiotic for that recently, but it turns out that it was viral. So it's important for you to go and look at that and then the internet is such a blessing. It's such a great tool for us to go and research all of it. And the CDC and NIH and FDA all have so many resources, great resources on their websites that talk about these conditions, and then look at the complications of those potential adverse reactions. Many times I get asked, oh, are speech delays listed on adverse reactions? From what I've come across, I've never seen speech delay listed, but there are things, according to the NIH, that can contribute or cause a speech delay that are listed on adverse reactions. Things like maybe eye issues or things with the mouth that can prevent or cause milestone delays. So it's important just for you to first start out in that section, in my opinion, as a parent, focus your efforts there. And then after that, I would go into the ingredients, researching what those ingredients are. And again, copy and pasting. And I personally, whenever I copy and paste something, I like to put .gov at the end of it because I want to know what the government says. If you want to find other resources, that's totally fine. But I personally, that's just what I like to do. And then you can just start to read and take the time and research and figure out what do you feel comfortable with and what makes sense for you.
Absolutely. Do you have any questions there? I have questions, but
I want to
give you a chance to talk, AK.
It's kind of a big question, and this is not prepared. I just came up with this question all by my.
Those are my
all
favorites.
by her lonesome.
Yep. Okay, so if you were going to add a section to the insert, what would be Alexandra's
That's a great question.
What would Alexandra say? Like inserts for dummies. What would be okay, Mom? This is the thing that you.
She wouldn't call it that, guys.
No, out of all of the. Well, it's kind of like a theme thing. Like put a yellow label on it, right? So, what is the thing that Alexandra would put in the insert to make sure? Hey, Mom, these are the things that you need to know. These are the effects in plain English. What would you put there?
Alternatives and how they compare to
Ooh.
alternatives.
Ooh,
that would be mine.
Factor. I would use comparison factors.
Yeah, and not comparison to the disease,
yes.
Because many of these products are known to potentially cause complications or breakthrough infections, or there's vaccine strains to the disease, things like that. I wouldn't touch on that because that's really complicated and messy. But I would let's talk about the alternatives and the ingredients and how it compares to these alternatives. I would like to see more clinical data and post-marketing data on that. That would be. That's pie in the sky. I don't see any manufacturer that would want to do that.
Not at all.
But as a parent, that's what I would want to see.
That's amazing. Can we do a little bit of a deep dive into a product that is common for newborns, vitamin K?
Mm-hmm.
Tell me what parents should know about what is out there for us to know, to learn about vitamin K that you feel that all parents should understand before that is given to a newborn.
Yeah, and I'll right up front acknowledge my bias. My daughter was injured by it. However, I never want anyone to make the decision to accept a layered declining product based on my personal experience. So everything that I'm going to share, I want you to go check me on it. I want you to go find the information. I have it all cited on the website. If you don't trust that, most of what I say you can find if you just put .gov at the end of it. So it's really important to understand that there's a preservative version and then there's a preservative-free version. I just did a post updating this because when I first started out reading inserts 4 years ago, there wasn't a warning in the manufacturer insert in the preservative version that said all neonates, so all babies, are to get the preservative-free version. That is updated guidance. And the reason is because there's benzyl alcohol in the preservative version, and that is known to cause gasping syndrome and can be fatal for babies. So right out the gate, I would recommend if you are going to accept vitamin K based on manufacturer guidance to get the preservative-free version. Now, unfortunately, I asked for the preservative-free version when I was in a birth center attached to a hospital. I was assured 100% that there was going to be one available. Unfortunately, by the time that I gave birth, I had a 44-hour labor. We could have a whole podcast on that. But when it was time to give, the vitamin K, there was no longer a preservative-free version. I was exhausted emotionally, spiritually, mentally. And so I ended up accepting the preservative version. So I think all preservative versions should be pulled from L&D offices or hospitals because of what the manufacturer says. Maybe that will happen in 3 to 5 years. Normally it takes that long for that change to happen. But as a parent, proactively make sure that if you're going to accept it, that you get the preservative-free version. It's also important to understand in the preservative-free version, there are still things like polysorbate 80. There are still other ingredients in there, like glacial acetic acid, that is known to cause eczema type reactions. And whenever you accept vitamin K, half of it is stored in the liver. So, and that's to prevent vitamin K deficiency bleeding, which can happen, I believe, up to 6 months. So a lot of these adverse reactions, according to the manufacturer, can be delayed up to a year. So if your child develops eczema or neonatal acne or things like that, that might be because of the vitamin K. And why is that important? It's important because if we know that it's stored in the liver, then there may be some things that you can do to address your baby's liver healing or supporting it, things like that. And for me, it wasn't explicitly stated on the insert, but my daughter also had gut issues. And so for me, we really focused on her gut. We also did focus on her liver to try to help her to heal in response to that. So I think going in, those are the main things that you really need to be aware of. The other thing you need to be aware of is that if your provider is really hounding you on vitamin K deficiency bleeding, which is what the synthetic vitamin K injection is given to prevent, it's also important for you to address other products that are given at that time that might increase your risk for vitamin K deficiency bleeding. I bring up the Hep B vaccination because the manufacturer for that vaccination lists thrombocytopenia as a known adverse reaction, which can prevent blood clotting. So if this is something that you truly are concerned about, absolutely look at the other things that might increase the risk for that. There are also things, research that I cited about a mother accepting antibiotics that could lower her gut flora, which could also lower the baby's gut flora and prevent vitamin K absorption. So there's so many other things that we need to be looking at as a whole if we're talking about vitamin K deficiency bleeding, not just this siloed analysis of one product. We need to be looking at all of the products because it is serious. It is something that we need to be aware of. And as parents, you need to understand the potential complications of that so then that you can be more informed.
Right. And delayed cord clamping is a huge one in there too.
Yes, thank you. Until it stops pulsing, because some people too. I was talking to a few L&D nurses, and they said, yeah, they do the delayed cord clamping, but they do it for 3 seconds.
Yes.
And so now I've said, no, just wait till it stops pulsing.
Just give the baby back all those blood cells, all those stem cells. I know I have patients who they're like, yes, we wanted delayed cord clamping, and they let us do it for 30 seconds to 1 minute, and I'm like, that is your body part. Who is letting you do anything?
Yeah.
You dictate it.
Right.
But yeah, that's wonderful points. Thank you so much for sharing all that. I know that topic is near and dear to your heart. So I appreciate you educating and kind of empowering other moms or, just parents to make empowered decisions.
Yeah. So join the informed consent conversation. If you have insights and questions for us, go to thediscoverydoc.com/podcast and you can leave us a voicemail, send us a memo, let us know all of your questions, and join us next week as we continue and wrap up our conversation with Alexandra. So you won't want to miss it.
If you're seeking a natural and targeted approach to enhance your well-being, consumable nature-derived peptides might be the perfect fit for your lifestyle and budget. Experience the incredible benefits of these powerful compounds that work harmoniously with your body to promote optimal health. Looking to build muscle, target stubborn fat, boost energy without the crash, or improve sleep quality? Peptides offer solutions for all of these concerns and more. For those interested in taking their wellness journey a step further, explore the world of injectable peptides designed exclusively for you by our experts at Discovery Wellness Group. By partnering with Discovery Wellness Group, you'll gain access to personalized plans tailored to meet your unique needs and goals. Are you ready to dive into the world of peptides and transform your life? Click the link in the podcast description or make an appointment with Discovery Wellness Group today. The power to optimize your well-being is just a click or a call away.
Welcome back to the Toxin Tamer feature of this episode. We're going to talk about why we should care about GMOs.
Yeah, absolutely. Stick with me for a little bit, guys. This is going to be, I'm going to read some things from an insert that I think is very important in terms of this topic. So this is directly from the FDA. It's a PDF that you guys can go look up that is labeled GMO crops and humanitarian resources for development. So this is a quote directly from their PDF. And it says, yes, GMO foods are carefully studied before they are sold to the public to ensure they are as safe as the foods we currently eat. These studies show that GMOs do not affect you differently than non-GMO foods. Okay, which is wonderful. So this PDF is about kind of the safety of GMOs and the history behind it. Where I find some hiccups is that when you click the first link connected to the words as safe as, so they hyperlink those words as safe as to put kind of the literature behind it as the proof behind that statement. When you click that link, it brings you to a Medline Plus article about what GMOs are, with its resources all listed as the same site from the FDA that you just came from. So rather than taking you to a actual research article, it takes you to another website, which directs you back to the FDA's website with no literature attached to it. When you click the link, the second link, so there's another link in that statement. So when you click the link connected to the word studies, right, it says that, yes, these GMO foods are carefully studied, and that word is hyperlinked. I click it, and it takes you to another FDA site within the FDA's website called Understanding New Plant Varieties. And it has zero literature or studies attached to it. So again, it kind of just loops you through another FDA website. But there are when I'm clicking the word studies, I'm expecting to see the actual evidence and studies that allow you to make this statement. And there are no literature studies attached to that hyperlink. The only link within that site, once you get to that Understanding New Plant Varieties site, is hyperlinked to the words better understanding genetically engineered foods. Okay, so I click on that and expect, okay, maybe this is taking me to the literature behind these statements.
Can you guess what there is there?
When you click that link, it takes you back to the FDA's agricultural biotechnology site, where again, no studies are listed on the safety. So
as of recording right now in February 2025.
Yes.
These links lead to nowhere.
Right. So, and that's my issue, is that if this information is so hard to find, that was me spending 30 minutes kind of going through these links and making sure, and I looked through everything, every hyperlink, to make sure that it's not readily available. The average consumer is not going to spend that much time. So if it's this hard for me to find, that to me is lack of transparency.
And we'd love to give you the hyperlinks, but FDA has decided not to provide those.
Yes. So meanwhile, that original FDA PDF, that's again labeled GMO Crops and Humanitarian Resources for Development, continues to go on about the safety. The PDF states, quote, GMO foods are as healthful and safe to eat as their non-GMO counterparts. Since GMO foods were introduced in the 1990s, research has shown us that they are just as safe as non-GMO foods. Additionally, research shows that GMO plants fed to farm animals are as safe as non-GMO animal foods.
Guess what? When you click the first link, it brings you to a publication about technology, not safety, which it told you that it was going to tell you about when it told you to click the link.
Yes.
You click the second link and it brings you to the same site as the first.
Do you see this roundabout method here? So in that statement, we're saying that it's safe. We're saying studies show, but we are not providing the actual studies. So Cece took it a step farther and said, okay, where are these studies then? And I scoured the internet. I mean, hours that I spent looking into this. And you will find words everywhere about, quote, they're just as safe as, quote, there's no increased risk, quote, they do not cause cancer. But you won't find one study backing those claims. So finally, throughout my just research of all of this, I landed on Bayer's website, of all websites.
Like the headache medicine Bayer's.
Yes, okay. Yes, who also owns other things. And I found, because they made these claims, they were just as safe as, etc. So I followed the links. Those links sent me to a website called biofortified.org. And they finally stated, hey, we have 610 scientific papers published in peer-reviewed journals, which evaluate the safety of foods derived from GMO crops. So I go on their website, and they list 126 of these out of the 610. So again, it's important to say that they are stating they have 610 scientific papers that evaluate the safety of foods derived from GMO crops. I then take that and say, okay, well then these studies should be proof that these are safe for humans. I went through all 126 that are actually listed on their website. Not one is on the safety in humans.
We're missing some receipts here.
Yes, not one. I'll give you a couple that I found that are the closest that I could get to backing these claims. One of them is titled A 90-Day Safety Study of Genetically Modified Rice in Rats. So for 90 days, they studied it in rats. And the second one is Detection of Corn Intrinsic and Recombinant DNA Fragments in the GI Contents of Pigs Fed Genetically Modified Corn. Out of all 126 studies, those are the two that I could even as closely as possible relate to the safety in humans.
Okay, so it's also not safe to just eat rice for 90 days. Let's start there.
Well, also in 90 days, that's 3 months.
That's not enough time.
It's not enough time.
You have eaten every day your entire life.
Yeah.
Now, you might have been sick. You might have done some intermittent fasting. You might have done, but for the most part, you're eating consistently and you're not just eating
But we're also talking about rats. We're not talking about humans here. So interestingly enough, the conclusion of these studies, which I think is very important to note, the conclusion was that the GI tract of the pigs fed genetically modified corn were positive for the specific GMO protein by ELISA and immunoblot, i.e., the researchers found how the corn was genetically modified. There's a little protein that was inserted. The researchers actually found that same protein not broken down in the pig's GI tract. So the results suggest that ingesting corn DNA and the modified protein were not totally degraded or broken down in the GI tract, as their presence was shown in a detectable form by PCR and blood testing. So if the pigs can't break it down, and 90% of corn in the United States is genetically modified in humans, let's make some deductive reason.
Okay, so if you cannot break down corn, and you know why you can't break down corn.
That's why I see it in your poop all the time, guys.
So if you are one of those people that cannot break down corn, which is probably almost all of us, and you're watching this on YouTube, drop a corn emoji in the comment. Let us know.
And a poop emoji. Let us know you find it in your poop.
Corn and poop. That's what we're looking for.
Looking for. Anywho, after spending these hours and hours and hours researching to find these so-called proven safe research, the only research I actually came across regarding the safety of genetically modified foods in humans is this. It is called the Evaluation of Adverse Effects and Events of Genetically Modified Food Consumption, a systematic review of animal and human studies. We'll link this in the show notes. I have the full, what is this called? Citing back from my TNP days.
Citation.
Thank you. I was like, PTSD from having to write research papers. I have the full citation that we will link so that you guys can look at it. But essentially, this research is a review of the only existing literature on the true safety of GMOs in terms of humans, which included only one crossover trial in humans and 203 animal studies. So the majority of which are still animal studies, but there is one study done in humans. It's the only one human trial that has been completed. And the findings, again, the only one as of February of 2025. The findings of that were serious adverse events of genetically modified consumption include increased mortality rate, tumors of cancer, significant low fertility, decreased learning and reaction abilities, severe stomach inflammation, intestinal adenoma lesions, and some organ abnormalities, specifically abnormalities within the mammary glands, breast tissue, pituitary, liver, and kidney. Additionally, reproductive toxicity included low survival rate, low birth weight, and increased carcinogenesis, so increased cancer-causing agents. So this was the one study in human trials, but also the conclusion of the review of 203 animal studies. So in my intense search, and you guys fact check this, I want literature, I want proof of these claims that are being made, and all these, studies that have been done to show that these foods are safe in humans. I want the receipts, I want the proof. I could not find them. I only found the adverse effects. How does that make you feel? It's wild, right?
I don't want to eat corn.
It's really wild. And especially, and again, if we go back to those stats, 94% of soy in the US, 90% of corn in the US is genetically modified, but there are tons of other foods that are genetically modified. And if you go back to what we were saying, that we're creatures of habit, we constantly eat the same foods. It's not about the one, right? But it is about us constantly being exposed to these organisms, constantly,
Right.
Consuming them through the variety of foods that are using this technology, and the increased risk that is potentially associated with it is pretty outstanding.
Yep. And even though you're not eating the soy, corn, or rice directly, the food that you're eating may be eating it. So that becomes a problem too. Have you seen, it's been going around lately, but it's a picture of a pig's leg, and one that is farm raised and one that is genetically.
And the fatty, yes.
Yeah. So lean muscle on the one that is homegrown, loved and cared for, all things raised for a purpose. And then there's factory farmed leg, and it has this much
3 inches of fat
on the outside. Yeah. So they're feeding them corn and soy to fatten them up to go to market. Did you know that this little piggy
went to market?
Yeah, he wasn't going shopping. Sorry, I just ruined a lot of childhoods.
Oh, that's sad.
Yeah. So
never thought about that.
Yeah. Isn't that crazy? We sung that as a little kid.
That's gross.
Like my mom's putting us to bed and rubbing our feet and pulling on our toes. This little piggy went wee all the way home. Okay. Anyway.
Home to Jesus.
he's in a better place now. But if we think that that's what it's doing to the animals, which is cruel and unusual, it's not how animals for production and consumption should be raised. Period. That's torture. But if we're putting that in them to make them make them bigger for market, what do you think it does to you when you eat corn and soy and oats and grains and all these things? Just some correlation. So I think that should be the animal to human study of, hey, if you eat oatmeal every day and corn every day and soybean oil and all the things, it's going to make it nice and plump and round.
Amongst other things. Yeah, absolutely. And I will say in terms of those studies that we're referencing, most of the adverse effects were reported from modified corn, soy, and rice. Those three. Those are the top. So a take-home point here, 94% of soy, 90% of corn in the United States is genetically modified. Know your sourcing. We'll talk a little bit more about this next week on how we can work to avoid GMOs or how we can understand where to find them, how to know what is genetically modified, and equip you with just the educational tools to make good decisions for you and your family. So stay tuned.
On this segment of Medical Myth Busting, we are talking about placebos. Do they actually heal?
Oh, this is a fun one. So placebo, the first thing that we need to know what a placebo is, right? So placebos are generally utilized in clinical trials, so double-blind clinical trials of whatever it might be, a new pharmaceutical drug, a new intervention, a new treatment, whatever it is. Placebo is as kind of a control group, and then you use that intervention as the experimental group, or vice versa. But can the placebo effect actually allow our mind to interact with our immune system to create a healing synergy? Do you think?
Heck yeah.
Absolutely. 110%. My answer is absolutely, absolutely yes. Placebo can be the most naturally occurring and powerful process of both physical and mental health, as we just talked about with our
centenarians.
Yes, in Japan, mindset was the largest contributing factor. So it absolutely can shift our cells. There are hundreds of experiments and literature that shows us mind over matter is real, that psychological factors absolutely impact the body, including our immune system. There are a couple cool ones that I want to go through because these are old. This is not new information. These aren't things that were found in 2020, 2021. These are things that date back to the 1950s. And so that creates a lot of validity there, in my opinion.
Do you know what? You and I are both from the 1900s.
Ew, isn't that gross? I know. I'm a 90s baby, and it hit me the other day. I was like, oh my gosh, there's probably like 12-year-olds being like, she was born in the 1900s. I'm like, I'm still a 90s baby. I feel young, but you're going to feel like I'm 200 years old.
Yeah.
Isn't that crazy?
Yeah.
That's wild. Okay. I'm glad you brought that up. I was thinking about that the other day too. Anywho.
We've been through some things.
Yes, we have. If we go all the way back to 1959, the New England Journal of Medicine published a study in which cardiology patients underwent fake operations for chest pain. We probably would not conduct this study now, but this was done, real study. Results showed that those patients who benefited from the quote procedure just as much as those who had the actual surgery. So the surgery was to tie off some of the arteries. And so there's a control group in which that procedure was not done, but they thought it was performed.
Mm-hmm.
And then there's the experimental group in which that surgery was actually performed. And all these patients had pain, chest pain, prior to that surgical procedure, quote, surgical procedure. In terms of reduction in pain and resuming normal activity and improving their imaging, they benefited the exact same.
Mm-hmm.
A fake procedure versus an actual procedure benefited the exact same in returning to normal activity, reduction in pain, and improvements on their imaging. So that means their imaging physiologically,
yep,
they actually changed.
And this was a really, really cool study because they actually went through, the placebo patients went through the check-in and the prep for surgery, and were laid out like all the things, and they woke up in recovery, and their body went through psychologically the same thing in the rehab and all the things that had to be done as the patients that actually had the procedure. And that's just phenomenal. So having this mental exercise, I do this all the time. I've implored it, especially when I was getting IVs and when I was going through my whole SOT thing of like, I'm imagining every molecule, every atom being turned off that needs to be turned off, like flip the light switch. And I'm sitting there going through my infusion and in my head clicking off all the light switches because I don't want them to replicate anymore. So I'm going through that mental exercise, and you can still do the same thing too with whatever's going through. Maybe it's, hey, I want to be a better morning person, or I want to go to sleep better, have better sleep hygiene. Go through the mental exercise of what would that look like? What would take place for that to happen? They also, go ahead.
I was just going to say, and in that aspect, change your dialogue. Instead of saying this is going to happen, make it present. Say this is happening. I am this. I am that. This is occurring.
Act as if.
Yes, my dreams are my reality now, not I'm going to, I can, I will. That's wonderful. But take that next step and say, this is now. This is happening now.
They did a very similar study with basketball players. So they had 3 groups of students. One did absolutely nothing. One got on the court and practiced and played and did all the drills. And then a third group only envisioned practice. So they envisioned their picks, their free throws, and they would throw 1,000 mental free throws. And the physical group and the mental group both performed the same way.
That's so cool, guys. The human body is amazing. We just have to give it the room to heal on its own without all these interventions.
Yep.
A couple others that are worth noting are, we can date studies all the way back to 1978 with papers published in the Lancet on placebos improving physical pain versus actual pain medications. In 2004, a study was published in Nature Neuroscience that details scans, actual imaging of Parkinson's patients' brains who responded in the same way with the same level of relief with a placebo versus a drug. So again, scanning the body and finding physical evidence, not just subjective, evidence in terms of what that patient is saying.
Yep.
Studies also date back to 2001 in the American Journal of Psychiatry showing that placebos improve depression, memory, attention against things like SSRIs. The brain is so, so, so powerful. So is it the placebo that can heal? No, it is you. It is you changing your brain pattern and your chemistry to think this intervention happened And then you are actually doing the work to heal your body yourself, not the placebo, but the mindset the placebo puts you in.
Yep. Your brain believes what you tell it. So have you ever had a dream and then like you had an argument with somebody or something happened and then you really think that it happened when you woke up?
Oh my gosh, I just punched Will in the gut 2 nights ago for this. I have to share this. He's going to kill me. No, I won't share it. Go ahead.
Okay, you can share it with me later.
Yeah.
But it is a total thing. Your brain cannot tell the difference between truth and reality. So if you are telling yourself lies, it's going to believe that is truth. So you have 70% of the choices is up to you.
Yeah.
So if you believe that you can't be healthy, you can't exercise, you can't eat healthy, you can't do all the things, well, then your body's going to listen to you and then that's not going to happen. So for those of you that are like me that have a chronic illness, my mindset, I've walked into doctors' offices and they have said, you don't look like you're sick. So it's all about the mindset 100%. So she can tell when I'm having a really, really bad day because she knows me, but no one else would be able to tell because I've gotten really good at hiding it because I have to live life and do the things. So it's all about the choice.
Yeah, absolutely.
100%.
It's all about the choice. And we have, 70,000 thoughts a day. Remember we use that stat in a different podcast, 70,000 thoughts per day. So you have 70% to work with outside of your genetic makeup and predisposition. Within that 70%, you have 70,000 thoughts per day, and you can make the active choice to make them positive, go-getter ones or negative ones. And that is going to drastically impact how you feel every single day. So your choice.
Yeah,
absolutely.
So as just a little side note, as a personal trainer, when I was coaching my clients, I would have them stand still without picking up any weights. And I have them make the brain muscle connection. So I'm like, okay, we're going to do bicep curls, but I want you to do them empty-handed. I want you to hold your hands like you're going to curl. And I want you to engage the muscle and curl. And we're going to do it 10 times. They're holding nothing in their hand, but their biceps are on fire. And then we pick up 3 pounds. Now I would make my big guys that would come in, like guys like Will, and I'm like, do 3 pounds. They're like, no, I need to do more. And I said, okay, but leave the 3 pounds right there because you're going to burn out in about 10 and you won't be able to finish the 30 that we have to do because we're using our brain power to activate the muscle of, I want this muscle to grow. So I'm going to not only physically flex it, but I'm going to also mentally flex it. And I would kill them every time. And they're like, how do you do that? I'm like, I didn't do it. You did it.
Yeah.
Like we are just making the mental connection, and we do the same thing with legs and abs. And they got really great workouts, no matter what weight of resistance that they were using. And my God, like they were like, can we stop, please?
Can we?
I'm like, no.
Of the mind.
I'm like, okay, you drop the things, but still flex, and it would still burn out their muscles, which is fantastic for you to know because tap into that 70% and you can have some
big old biceps.
Lean, strong muscle. We want lengthened limbs.
Buddy.
As girls.
Anyways, stay tuned for our next episode as we continue to bust some myths out there. We hope that you guys are learning. And if you have any myths that you would like to bust, shoot us a message, thediscoverydoc.com/podcast so that we can answer any questions that you have.
Until next time,
let's discover together.
We hope this episode has provided valuable insights into navigating pediatric medicine and making well-informed decisions as a parent. Additionally, we have explored the potential dangers of GMOs and uncovered the incredible healing power of the placebo effect. Keep asking questions, seeking knowledge, and advocating for your family's health. Tune in next time for more eye-opening discussions on wellness, and remember, you hold the power to create positive change.
Hold your horses. Before we ride off into the sunset, let's take a moment for a friendly disclaimer. The information shared on this podcast is for general, informational, and entertainment purposes only. While we strive to provide accurate and helpful information, we're not here to replace your trusty healthcare provider or doctor. Consider us your Discovery Doc trailblazers, sharing our knowledge and experiences as we journey forward towards wellness. However, remember to always consult with a qualified medical professional before taking any actions based on the content of this episode. Like the Wild West adventure, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy,
Stay adventurous and keep blazing trails with the Discovery Duck.